NCSBN RN Test Bank 800 Questions and Answers Newest Full Guide. Question 1. Painless vaginal bleeding in the last trimester may be caused by? Option A. Menstruation. Option B. Abruptio placentae. Option C. Placenta previa. Option D. Polyhydramnios. The correct answer is option C. Placenta previa. Placenta previa occurs when the placenta separates from the uterine wall, causing painless bleeding. Question 2. What observation is made in the taking hold phase of postpartum bonding? Option A. Mother concerned about recovery. Option B. Mother calls infant by name. Option C. Mother lightly touches infant. Option D. Mother concerned about weight gain. The correct answer is option B. Mother calls infant by name. The taking hold phase involves active involvement of the mother with her infant, including calling the baby by name. Question 3. What medication is anticipated for induction of labor? Option A. Oxytocin. Option B. Progesterone. Option C. Vasopressin. Option D. Ergonovine maleate. The correct answer is option A. Oxytocin. Oxytocin is the hormone that produces uterine contractions used for the induction of labor. Question 4. The second stage of labor is characterized by the client desire to: Option A. Push during contractions. Option B. Hyperventilate. Option C. Walk. Option D. Relax. The correct answer is option A. Push during contractions. The second stage of labor is characterized by full cervical dilatation resulting in the urge to bear down. Question 5. A laboring client is irritable and feels the urge to vomit. This is the: Option A. Fourth stage. Option B. Third stage. Option C. Transition stage. Option D. Second stage. The correct answer is option C. Transition stage. Transition stage is characterized by high irritability, restlessness, nausea, and vomiting. Question 6. A pregnant client experiences spontaneous rupture of membranes. What is the first nursing action? Option A. To assess client respirations. Option B. To notify physician. Option C. Auscultate fetal heart rate. Option D. A transfer to delivery suite. The correct answer is option C. Auscultate fetal heart rate. Fetal heart rate must be assessed immediately to check for cord prolapse following membrane rupture. Question 7. What is the nursing action during a precipitous delivery? Option A. Control the delivery. Option B. Leave to call physician. Option C. Push against perineum. Option D. Cross client legs. The correct answer is option A. Control the delivery. Controlling the rapid delivery of the fetal head reduces the risk of fetal injury and perineal lacerations. Question 8. Following a vaginal delivery, what should the nurse observe for? Option A. Dystocia. Option B. Chadwick sign. Option C. Fatigue. Option D. A hemorrhage and infection. The correct answer is option D. Hemorrhage and infection. Hemorrhage and infection are the primary potential complications following a vaginal delivery. Question 9. A pregnant client has pyelonephritis. Which antibiotic is safest? Option A. Oxytocin. Option B. Magnesium sulfate. Option C. Ampicillin. Option D. Tetracycline. The correct answer is option C. Ampicillin. Ampicillin is a penicillin derivative with no known teratogenic effects, making it the safest antibiotic during pregnancy. Question 10. A newborn of a diabetic mother exhibits tremors and poor sucking reflex. The nurse suspects: Option A. Central nervous system damage. Option B. Hypoglycemia. Option C. Hyperglycemia. Option D. Normal newborn responses. The correct answer is option B. Hypoglycemia. Infants of diabetic mothers often produce excess insulin in utero, leading to hypoglycemia after birth. Question 11. What intervention reduces the risk of retrolental fibroplasia in premature infants? Option A. Maintain oxygen less than 40%. Option B. Maintain oxygen greater than 40%. Option C. Give moist oxygen greater than 40%. Option D. Maintain on 100% oxygen. The correct answer is option A. Maintain oxygen less than 40%. Retrolental fibroplasia is associated with prolonged exposure to high levels of oxygen. Question 12. A psychiatric client is crying hysterically with severe anxiety. What is the first nursing action? Option A. Demand that she relax. Option B. Ask what the problem is. Option C. Stand or sit next to her. Option D. Give her something to do. The correct answer is option C. Stand or sit next to her. Presence and proximity convey support and security to an anxious client. Question 13. A client has a 20% weight loss and induces vomiting. What is the diagnosis? Option A. Anorexia nervosa. Option B. Anorexia hysteria. Option C. Bulimia. Option D. Conversion reaction. The correct answer is option C. Bulimia. Bulimia is characterized by food binges followed by self-induced purging or vomiting. Question 14. A client says I am God. What is this? Option A. Delusion. Option B. Illusion. Option C. Hallucination. Option D. Conversion. The correct answer is option A. Delusion. A delusion is a fixed false belief. Question 15. A client has blindness with no organic cause. What is this? Option A. Delusion. Option B. Illusion. Option C. Hallucination. Option D. Conversion. The correct answer is option D. Conversion. Conversion involves expressing emotional conflict through sensory or motor manifestations. Question 16. A client hospitalized for diagnostic tests becomes dependent and demanding. What is this defense mechanism? Option A. Denial. Option B. Displacement. Option C. Regression. Option D. Projection. The correct answer is option C. Regression. Regression is the return to an earlier stage of development. Question 17. What is the primary nursing goal for a client with organic brain disorder? Option A. Organized safe environment. Option B. Long family visits. Option C. Detailed explanations. Option D. Challenging programs. The correct answer is option A. Organized safe environment. Safety and consistency are the priority goals for clients with cognitive deficits. Question 18. What is the primary goal for a preschool program for children with Down syndrome? Option A. Provide respite care. Option B. Facilitate optimal development. Option C. Provide demanding education. Option D. Prepare for mainstream education. The correct answer is option B. Facilitate optimal development. Facilitation of optimal growth and development is essential for all children regardless of disability. Question 19. A 13-year-old hemophiliac has hemarthrosis. How should the nurse relieve pain? Option A. Elevate and splint knee. Option B. Apply moist heat. Option C. Administer aspirin. Option D. Encourage active range of motion. The correct answer is option A. Elevate and splint knee. Immobilization and splinting reduce bleeding and subsequent pain in hemarthrosis. Question 20. A 3-month-old has a cleft lip repair. How should the nurse feed the infant? Option A. Gavage tube. Option B. Nipple and bottle. Option C. Straw and cup. Option D. Syringe. The correct answer is option D. Syringe. A syringe places formula in the back of the mouth, minimizing sucking pressure on the suture line. Question 21. What is the first symptom indicating increased intracranial pressure in a child? Option A. Bulging fontanelles. Option B. Seizure. Option C. Headache. Option D. Ataxia. The correct answer is option C. Headache. Headache is a classic early symptom of increased intracranial pressure in children. Question 22. What is the correct positioning for a child with increased intracranial pressure? Option A. Head elevated 30 degrees with neutral position. Option B. A flat. Option C. Head turned to side. Option D. A frequent stimulation. The correct answer is option A. Head elevated 30 degrees with neutral position. Head elevation and neutral positioning promote venous drainage and reduce intracranial pressure. Question 23. What is the correct positioning for a client 2 hours post-ventriculoperitoneal shunt? Option A. Elevated head on non-operative side. Option B. Elevated head on operative side. Option C. Flat on operative side. Option D. A flat on non-operative side. The correct answer is option D. Flat on non-operative side. A flat position on the non-operative side prevents pressure on the shunt and rapid fluid reduction. Question 24. What lab value indicates a need for notification of a physician for a child with tetralogy of Fallot? Option A. pH 7.39. Option B. WBC 10,000. Option C. Hematocrit 60%. Option D. A bleeding time of 4 minutes. The correct answer is option C. Hematocrit 60%. A hematocrit of 60% indicates polycythemia, which is a common complication of cyanotic heart disease. Question 25. Why does the nurse use volume control tubing for a 2-month-old? Option A. Prevents drug administration. Option B. Prevents air entry. Option C. Prevents administration of large amounts of fluid. Option D. Prevents phlebitis. The correct answer is option C. Prevents administration of large amounts of fluid. Volume control sets allow the nurse to accurately regulate the volume of fluid over a set period. Question 26. Which insulin can be administered by continuous intravenous drip? Option A. Humulin N. Option B. NPH insulin. Option C. Regular insulin. Option D. Long-acting insulin. The correct answer is option C. Regular insulin. Regular insulin is the only type of insulin that can be safely administered intravenously. Question 27. Administer furosemide 0.5 ml when bottle is 10 mg per milliliter. What is the dose? Option A. 5 mg. Option B. A 0.5 mg. Option C. 0.05 mg. Option D. 20 mg. The correct answer is option A. 5 mg. 5 mg is the dose because 0.5 milliliters multiplied by 10 mg per milliliter equals 5 mg. Question 28. Administer KCl 1.5 milliliters when bottle is 20 milliequivalents per 15 milliliters. What is the dose? Option A. 1 milliequivalent. Option B. 1.13 milliequivalents. Option C. 2 milliequivalents. Option D. Insufficient information. The correct answer is option C. 2 milliequivalents. 2 milliequivalents is the dose because 1.5 milliliters equals 1/10 of 15 milliliters, which equals 2 milliequivalents. Question 29. 1000 milliliters to infuse in 8 hours at 10 drops per milliliter. How many drops per minute? Option A. 125. Option B. 48. Option C. 20. Option D. 21. The correct answer is option D. 21. 21 drops per minute is the rate after calculating and rounding. Question 30. 1000 milliliters to infuse in 8 hours at 60 drops per milliliter. How many drops per minute? Option A. 75. Option B. 100. Option C. 125. Option D. 150. The correct answer is option C. 125. 125 drops per minute is the calculated rate. Question 31. Administer 0.25 saline at 50 milliliters per hour with microdrip. How many drops per minute? Option A. 1. Option B. 5. Option C. 50. Option D. 100. The correct answer is option C. 50. 50 drops per minute is the correct rate for a 50 milliliter per hour infusion using microdrip tubing. Question 32. What should the nurse assess for during a 6-year-old vision screening? Option A. A hearing test. Option B. Gait. Option C. A strabismus. Option D. Papilledema. The correct answer is option C, strabismus. Strabismus is easily assessed during routine vision screening in preschool and school-age children. Question 33. What is the first action for a child with partial thickness burns to both legs 15 minutes post-accident? Option A, apply ice packs. Option B, remove charred clothing. Option C, apply Silvadene. Option D, immerse in cool water. The correct answer is option D, immerse in cool water. Cool water permits gradual temperature regulation and prevents extension of the thermal injury. Question 34. Which immunization is a priority concern for a burn victim? Option A, oral poliovirus. Option B, inactivated poliovirus. Option C, tetanus toxoid. Option D, a hepatitis B. The correct answer is option C, tetanus toxoid. Tetanus is transmitted through contaminated wounds, making tetanus prophylaxis a priority for burn victims. Question 35. How should the nurse position a newborn with a meningomyelocele? Option A, prone. Option B, supine. Option C, side-lying. Option D, semi-fowler. The correct answer is option A, prone. The prone position reduces pressure and tension on the sac, preventing trauma or infection. Question 36. What is the appropriate care for the sac of a child with meningomyelocele? Option A, a dry sterile dressing. Option B, a saline-soaked sterile dressing. Option C, open to air. Option D, aspirate fluid. The correct answer is option B, saline-soaked sterile dressing. A saline-soaked dressing protects the sac from contamination and prevents drying. Question 37. A client with diabetic ketoacidosis has pH 7.2 Pa 290 PaCO 245 and HCO 316. What does this indicate? Option A, respiratory alkalosis. Option B, respiratory acidosis. Option C, metabolic alkalosis. Option D, metabolic acidosis. The correct answer is option D, metabolic acidosis. A metabolic acidosis is indicated by a low pH and a low bicarbonate level. Question 38. A client with asthma has pH 7.28 Pa 254 PCO 260 and HCO 324. What does this indicate? Option A, respiratory alkalosis. Option B, respiratory acidosis. Option C, metabolic alkalosis. Option D, metabolic acidosis. The correct answer is option B, respiratory acidosis. Respiratory acidosis is indicated by a low pH and an elevated PCO2 level. Question 39. What is the most common early complication of a myocardial infarction? Option A, diabetes mellitus. Option B, anaphylactic shock. Option C, cardiac hypertrophy. Option D, cardiac dysrhythmia. The correct answer is option D, cardiac dysrhythmia. Myocardial damage interrupts electrical impulses, leading to irritability and common dysrhythmias. Question 40. A heart failure client takes digoxin and furosemide. Which laboratory test must be monitored? Option A, intake and output. Option B, calcium. Option C, potassium. Option D, magnesium. The correct answer is option C, potassium. Furosemide is a potassium-depleting diuretic, and hypokalemia significantly enhances digoxin toxicity. Question 41. A client with premature ventricular contractions should be anticipated to receive? Option A, furosemide. Option B, nitroglycerin. Option C, lidocaine. Option D, digoxin. The correct answer is option C, lidocaine. Lidocaine is the standard drug used to suppress ectopic ventricular beats. Question 42. What diet instruction should a cardiac client receive? Option A, increase fresh vegetables. Option B, decrease canned vegetables. Option C, increase breads and cereals. Option D, eat more fish. The correct answer is option B, decrease canned vegetables. Canned vegetables are typically high in sodium and should be avoided in heart failure. Question 43. Which lab test evaluates the effectiveness of warfarin therapy? Option A, prothrombin time. Option B, partial thromboplastin time. Option C, PTTC. Option D, fibrin split products. The correct answer is option A, prothrombin time. Prothrombin time is the standard test for monitoring warfarin anticoagulation. Question 44. What is the priority assessment before administering digoxin? Option A, respiratory rate. Option B, radial pulse. Option C, 2-minute radial pulse. Option D, 1-minute apical pulse. The correct answer is option D, 1-minute apical pulse. The apical pulse must be auscultated for 1 minute to ensure the heart rate is within safe parameters for digoxin administration.